Okay, you can go down onto the front, head in the hole. So what I'm aiming to do now is just to show you some general treatment as I would do it, and I'm sure Kate at some point and other tutors will show you. So you're just picking up bits that you might not see from them or from others. You can use that in your treatment. Effleurage, back to weekend 1. Petrissage, what are we doing with these 2 initial strokes? Remind me.
Warming up muscles.
Warming up the muscles, introducing them to a touch, spreading the lotion. How's that pressure, Kate?
Perfect.
Good. So let's really feel what's going on with these tissues. Rather than aim to just go deeper, and aim to have a feel for any restrictions. I want to go all the way up into that proximal tendon, into the ischial tuberosity, keep contact on the way back, cover from medial to lateral. Don't forget the ITB while you're here. Open palms usually enough for that. We'll start to see them wince. How's that, Kate?
All right.
Good. So let's have a really good feel of that tendon. Up into the ischial tuberosity.
Oh.
I'm still keeping within the bounds of the towel, you probably can't see. I'm going to do some frictions there in that tendon.
Okay.
Because, oh, there we go. So I'm trying to kind of work over it transversely. It's just popping under my fingers. So I'm going to hold my place and some frictions, about 10 seconds, not moving over the skin. All right, Kate?
Yep.
And then make her forget all about it with some effleurage and petrissage and all that stuff.
So sorry, just to recap, the frictions, just for my brain while we're here doing it, you found where the point of the tendon was there, and you were just very intensely for a few seconds rolling over the tendon there.
We're not even rolling over the tendon. If I do it down here on a distal tendon, just about there, so I was trying to work over that tendon, but it was difficult to get into because of its nature and its makeup. It's kind of just falling about all over the place. So instead what I'll do is come into the side of the tendon just so that I can actually get some pressure into it, and then I'm not moving over the skin at all. I'm just pressing those fingers in and applying some frictions one way or the other. So that's what I'm doing there, holding that for about maybe 10 seconds. It's quite inflammatory, it can be quite painful, so we don't want to overdo it. And that was just up here. Have a little feel of that when you get around to treatment into the hamstring tendon, because it's quite a nice way of affecting that. What else can we do here for the hamstrings then? How about a little bit of STR? Technical STR would be hold the lock in place, push away from the insertion, and then extend the joint. But we can do a bit of that massage and movement as well. And if we really want to get in there with some pressure, Kate, hold the leg there for me. We can go in with an active STR. Okay, and leg down. Good, and back up. And go again.
Oh my god.
And back up.
That's really intense.
And go again. Good, that's quite intense. Let's give her a break. Leg down. Lots of intense stuff there, so let's give her a little break. More petrissage. Thumbs into the ITB, fingers into the adductors. Don't forget everything in the leg, not just posterior aspect. Onto the calf. This gives me a good chance to show you some NMT. Lateral and also sometimes medial head of gastroc are going to be quite painful. Most acupressure points or trigger points are going to be right in the center of the muscle belly, and there's no coincidence that that's usually where these dry needling points are. We put the needles into. So I've spread the lotion, I've done the effleurage, done the nice stuff, sorry Kate, but now we're into a slightly deeper stuff, reinforced thumb.
Oh.
I'm feeling how those tissues move under my thumb. I'm moving longitudinally, but it's easier to put pressure in there than it is transverse.
Ooh.
Finish the stroke through the origins and back. So now you've got an idea, Kate, of what that felt like from point A to point B.
Yeah.
I want you to let me know where's the most tender spot, okay? I'm guessing somewhere around there. Up into the gastroc.
Yeah. That feels awful.
So I'm pushing the same pressure through, but I can feel that restricted when I get there. So now it's probably a point of tenderness, point of restriction. Can you feel that refer anywhere?
No.
Okay, just where it is.
Yeah.
So we call that a reflex point. Number?
8.
Okay, I'm going to ease off just a touch. How about now?
Better.
Okay, number?
3.
Well, I just felt that move under my thumb there, so something's happened. But we can go in there with what would take 1.5 to 2 minutes of trigger point technique, which I'm not going to do now. I'm sure you'll be glad to know. Maybe that was gastro, but maybe it wasn't. So let's have a feel with the leg up, knee flexed. Now we can isolate soleus a bit more and see, is there any way that we can get into that a bit better?
Well, that's really intense.
Okay, so I'll take some of that pressure off. Number now?
8.
Okay, more pressure off. Really easy for me. This.
7 now.
Great, okay. So I think maybe soleus is probably the better option here for that trigger point. So I'm going to make things easy for myself, maybe slightly harder for Kate. Into that same spot. Number?
8.
Okay, and now?
7. 6.
Perfect. So I'm just going to keep that pressure on, NMT style, wait for it to reduce, increase again, and keep doing that same cycle until we've got nothing, a decent amount of pressure. More STRs then in this position. Let's use this dorsiflexion, just relax the leg. It's quite common for people to dorsiflex and you'll feel that tendon and tibialis anterior go. So try and get them to keep that relaxed there, just to let you do the dorsiflexion. Bit of massage and movement again. Maybe want to target soleus with the STRs. So when I say I want you to actively dorsiflex like that for me, please. Go. Okay, and relax. Go.
Oh yeah. Oh my god.
And relax. Go. And relax. So what's happening there? The fingers just medial to the tibia around there. They're intersoleus, but they're also intertibialis posterior.
Yeah.
So both of those muscles plan to flex. Kate dorsiflexes, we get a stretch. Go. Good. Massage and movement back up and go. And relax. Good. Let's have a look at some ankle and heel stuff as well. Just because there's no soft tissue there doesn't mean we can't work into it. Pads of thumbs. Squeeze and lift. METs that we can do here as well. I want you to push into my hand. 8, 9, 10, relax. And then we've got some more dorsiflexion.